Now let's talk about the ovaries and the fallopian tubes themselves. This is a coronal section here through the reproductive system of the female. So you can see the ovary here held to the uterus with a ligament. Notice that's not the path that the eggs take. The eggs go this scenic route along the fallopian tube, which opens into the uterus here. And then we already talked about the cervix here and the vagina. And remember that the uterus does sit on top of the bladder, which, yes, is very inconvenient if you have, a fetus growing in your uterus. The broad ligament is, as it sounds, a very broad, wide ligament that lays across the uterus and the ovaries and the ligaments and the fallopian tube, covering all of it and holding it all in place. Then this is the ovarian ligament there. Okay, and you can see there's tons and tons of blood vessels supplying the uterus because the uterus during a pregnancy is going to have a ton of work to do. We're going to come back to that. Right now we're going to focus on the ovary. So the ovary has a capsule of connective tissue around it. The outer layer is called the cortex, and then the inner portion is called the medulla. The outer portion, this cortex, is where the follicles are, and those follicles are where the oocytes, which will become the eggs, that's where they develop. The medulla provides pathways for the blood vessels and the nerves going in and out. The uterine tube or the fallopian tube, like I said, is connected by fimbriae. It does catch the eggs when they are ovulated, which is the name for released from the ovary. Except they do more than that. So they are aligned with cilia that propel the egg down. After ejaculation, sperm travel up through the uterus, up into the fallopian tube, and fertilization normally happens in the fallopian tube. At that point, the oocyte becomes a mature egg, and then it becomes a zygote, which is an individual cell, one cell, with a diploid nucleus, 2 copies of each chromosome. The egg and the sperm each have 1 copy of each chromosome. The zygote then starts doing mitosis. So it does its first split, it makes 2 cells, then it divides again, makes 4 cells, etc., etc., etc. And under normal circumstances, about a week later, it implants as a blastocyst, which is a ball of cells, into the wall of the uterus. That's the normal way that a pregnancy starts. Notice that there's about a week between ovulation and implantation, which is where we definitely have a pregnancy. Sometimes that system doesn't work out correctly, and we have what is called an ectopic pregnancy. An ectopic pregnancy is where a blastocyst, this ball of cells, implants either in the fallopian tube or somewhere outside, anywhere but the uterus. Remember that because the fimbriae aren't actually attached to the ovary, sometimes, every once in a while, an egg escapes. Well, if a sperm escapes too, fertilization can happen somewhere out in the abdominal cavity. Most commonly, ectopic pregnancies happen in the fallopian tube. And the blastocyst implants and starts to grow into the wall of the fallopian tube, and the little embryo and fetus actually starts to develop. The fallopian tube can stretch quite a bit, and it can accommodate up to about 8 weeks of development, but it can't stretch beyond that. It's not a uterus. A uterus is going to grow and expand and stretch during a pregnancy. A fallopian tube literally can't. A woman who has an ectopic pregnancy will have severe cramping. She may have bleeding. They do sometimes miscarry or spontaneously abort on their own. More often than not, they have to be removed surgically. Now, here's the important thing to know. If this isn't removed, the fallopian tube will burst. A woman can bleed out and die of internal bleeding as a result of a ruptured ectopic pregnancy, a ruptured fallopian tube. Because of the way that the blastocyst implants into the wall of the uterus, and the amniotic sac and the placenta start to grow, you can't remove an ectopic pregnancy. You can't take it out and implant it somewhere else. It actually starts to grow through the wall that it implants in. And it cannot be moved. It's not biologically possible. That did not stop lawmakers in either Georgia or Atlanta, and I should really remember, although maybe it's not relevant, from passing a law that stated that doctors had to move an ectopic pregnancy and implant it into the uterus. It was going to be required under the law. That law passed. It did not go into effect. It was blocked by the courts, but that law is on the books. So please understand that it is important. If you are a citizen and you are able to vote, please educate yourself and make sure that the people you are voting for are not so ignorant that they will require doctors to do things that are not biologically possible, and that require extra surgery on a woman. So that is the ectopic pregnancy. I hope you never have to experience one. And know that the people who are making laws about women's bodies really don't understand how they work.